Myself Salma Saidhu, pursuing fellowship in Pediatric Optometry from Indian Academy of Optometry. So today let's discuss or brief about on the topic vision therapy. Vision therapy is an attempt to improve or develop the visual skills and abilities. It increases the visual comfort, ease and efficiency of the vision to an extent. It tries to treat certain problems like lazy eye, that means amblyopia, then eye turn, that means strabismus or squint, and binocular vision problems. We cannot tell that vision therapy will completely try to cure these type of diseases or these type of conditions. To an extent, we can tell that to an extent they try to treat these type of conditions. So let's discuss about some of the vision therapy techniques one by one. Vision therapy software. Nowadays, a list of vision therapy softwares are available in the market. So let's discuss about one of the most advanced and world's first advanced vision therapy software, that is Curacy. First of all, let's discuss about the Curacy. What are the uses of Curacy, or to whom we can use this Curacy software? First one, it can be used by the amblyopic patient. That means the patient having lazy eye. It can be used by amblyopic patient. Second one, it can be used for the patients who have undergone the refractive surgeries. Any type of refractive surgery for myopia, hypermetropia or astigmatism or certain things. It can be used by all patients who have undergone refractive surgery. Then it can be used by the patients who have implanted scleral or mini scleral lenses. Then it can be used by the patients who have computer vision syndrome. As we all know, computer vision syndrome is a major problem faced by the young generation nowadays. Then, it have a huge list of merits. Let's discuss about that. First and the most important merit of the Curacy software, it is affordable and the most efficient vision therapy software available. Then, it can be used by the all age group patients. That means it does not have any age limit to use. Neither it is categorized for children nor for adults or not for anyone. It can be used by any age group patients. Then it is the most efficient, as we all know, it is the most efficient vision therapy software. So it can be used for treatment and the diagnosis of binocular vision problems. Then we does not want to go to the clinic or any ophthalmologist or any optometrist to do this vision therapy software. At home itself, we can do this vision therapy using this software. It is the most time-consuming as we all know, it is the most time-consuming software available in the market nowadays. So, how to use this Curacy software? This Curacy software contains a huge list of versions exercises. By entering into the software, we can use these versions exercises to treat to a certain extent of our problems. Then the most important thing is that in the amblyopia conditions, we does not want to patch our eyes. In every exercises, we are suggested or we are advised to patch our eyes to do the exercises. But in this software, we does not want to patch the eyes. Instead, we are asked to use red or blue glasses to use this software. It is only available in the amblyopia conditions. Then, the most interesting factor about the Curacy software is that, as we told earlier, these versions exercises are sorted in the form of game. So it will be more interesting for the patients to do the exercises on the daily basis. We are going to discuss on vision therapy is pencil push-up therapy. Pencil push-up therapy is a method that we are used to treat convergence insufficiency. So it is also called as NPC exercises. As we know, convergence insufficiency is a condition in which patient is unable to focus both their eyes together on a nearby object. So it is a best method to correct the convergence insufficiency. Convergence insufficiency can be treated by regularly doing these type of exercises and increasing the strength of their convergence. It cannot be this convergence insufficiency exercises, that is pencil push-up therapy, is not such an effective method for children or young adults. Then we are asking the patient to do this convergence insufficiency exercises. That means pencil push-up therapy on a regular basis. That means 3 times a day to increase their convergence power to up to 3 months or longer than that. Then, how to do this pencil push-up therapy? Ask the patient to hold a pencil. All the pencil will be written by their name on the pencil. So, ask the patient to focus onto a letter on the pencil and hold the pencil towards in front of their eyes at an arm length. Then ask the patient to bring the pencil towards their nose by focusing onto this object. Make sure that keep always a sight of clear into this alphabet. It should be our eyesight should be clear towards this letter on the pencil. Then do this exercise regularly to improve our convergence, and at a daily basis we can do this. That means 3 times a day. It will improve our convergence, and later on we can get rid of this convergence insufficiency problem. Next method in the vision therapy is patching or occlusion therapy. In this patching or occlusion therapy, the treatment is done by covering one of the eye to get encouraged for the other eye to use more. That means in amblyopic condition, one eye is called as lazy eye. So in occlusion therapy, the normal eye gets covered to increase the use of this lazy eye. As we increase the use of patching, this weaker eye become more strengthened to be used, and this underdeveloped eye can become normal. So it can be done within an age limit of 8 to 10 years. After that, it is not that much as effective within this age time. So in this treatment, mainly the normal eye is covered and the lazy eye, that means the weaker eye, gets more effort to use and increases the vision of that eye. There are 3 types of occlusion, that is conventional or inverse, partial and full time, and total occlusion. In this conventional type of occlusion, that means the lazy eye get more strengthened to use by covering the stronger eye. Then in this inverse method, first of all we cover our normal eye. Then first of all we cover our lazy eye. Then the normal eye will be having an eccentric fixation. So first of all correct the eccentric fixation and then patch the stronger eye and increases the use of this lazy eye. Then the next method is full time. Full time means the regular patching of the eye. That means within a specific time limit we will patch our stronger eye and increases the use of the lazy eye. Then full time and next one is total. That means full time our stronger eye gets patched and increases the use of this lazy eye. But for the children it is very difficult of the total occlusion. So we prefers the partial occlusion. That means within a particular time we will patch our normal eye. Then we will give a break to the patient so that they get a relief. This total occlusion is very difficult for the patient, as our stronger eye get covered for full day, full time. So we suggest partial or part-time occlusion for the patient, as it is more preferable for the young children. The next method of vision therapy is Synaptophore. Synaptophore is also called as major amblyoscope. It is an instrument used for the diagnosis of the imbalance of the eye muscles and treating them by orthoptic methods. It is specifically used for children above the 3 years of age. Then the uses of Synaptophore is find the potential for binocular vision in the presence of manifest squint. Then it is used for detecting suppression and detecting abnormal retinal correspondence. It is mainly used to find 3 grades of binocular vision. It is used for finding the 3 grades of binocular vision, that is simultaneous perception, fusion and stereopsis. It is mainly found out by looking through two cylindrical tubes that is present in the synaptophore. We are asked to look through these two tubes which have an eyepiece of plus 6.50 diopter, which gives a effect of 6 meter distance. Then which grade we want to find, according to that different slides are inserted into the slide carrier and we are asked to look through this. Then we can find out horizontal, vertical and torsional misalignments through these methods. This is the working of the synaptophore. Method in the vision therapy is lens or prism fixation. The lens or prism fixation can be given to the patients who complained about asthenopic symptoms and mainly diplopia. Then these prisms and lens fixation are given to the patients by incorporating them into the ear contact lenses or spectacles. Mainly these incorporating of prisms in the spectacles make the disfigurement for the patient and makes a drawback in their cosmetic appearance. So the patients hesitate to wear the spectacles by incorporating the prism. And mainly the patients who have undergone the refractive surgery, they are not willing to wear the spectacles especially. So incorporating the prism will make them more difficult to get adopted to that. Then the next method is incorporating this power into the contact lens. It is a good method. Who wear contact lenses can adopt this very easily. But spectacle wearing persons will make a disfigurement, so they never allowed to wear this spectacle along with incorporating the prism. Then mainly the non-strabismic disorders such as esotropia, then divergence excess, divergence insufficiency, etc. These patients get treated by using the prism, incorporating into their spectacle or contact lenses and make them more efficient in this vision therapy. Then by incorporating the prism in the vision therapy will help to a certain extent by reducing the prism diopters gradually by a continuous use. Then the next method is in the cases of convergence insufficiency, convergence excess, etc. The lens can be incorporated for their use and gradually we can decrease the power by doing this type of vision therapy. These are the briefing of the vision therapy method by lens or prism fixation. These are the methods that are used in nowadays for the vision therapy, that are push-up pencil theory, synaptophore, lens and prism fixation, occlusion therapy or patching exercise, and vision therapy softwares. Thank you.